Welcome to the Heart of It, where we take you to the heart of healthcare. This season, we're exploring what happens behind the scenes at Fraser Health to ensure patients receive the best care possible. Fraser Health provides care on the traditional, ancestral, and unceded lands of the Coast Salish and Inklakatma nations and is home to 32 First Nations within the Fraser Salish region. Fraser Health is dedicated to serving all Indigenous people and honors the unique cultures of the First Nations, Métis, and Inuit living within the Fraser Salish region.
Today I'm joined by Bernice Oxley, who's our Regional Operations Director for Medical Imaging for Fraser Health. Welcome, Bernice.
Thank you for having me.
Thank you for being here. When we're saying medical imaging, what does it actually encompass?
So medical imaging is a number of modalities, X-ray, CT, mammography, bone densitometry, nuclear medicine, interventional radiography, MRI, ultrasound, echocardiography. So we're a really big department in the hospitals, but most people don't really know we're there unless they have opportunity to need our services.
For most people that you encounter, I imagine they'll either come through from referrals from family doctor's office or sometimes through emergency departments.
That's right. So everybody needs a physician referral, either through a clinic, family doctor, emergency department. The only exception to that is for screening mammography programs. That is a self-referral program.
So what happens behind the scenes after that referral is
So when
sent to
the
you?
referral comes in, especially for something like a CT scan, it first goes to a radiologist who protocols it based on priority, and that's based on the clinical information that's provided on the requisition. Because we do have to prioritize patients for urgency. Yes. Once it's categorized, it goes back to someone on the technical team, which codes it for the slot it goes into, because we need to determine, is it a CT scan with contrast, without contrast, how much time on the table, depending on what it is. Then it goes to the booking clerk, who, finds time for it and then communicates that either back to the doctor's office to let the patient know or calls the patient themselves to let them know.
And the conversation then happens either directly through the family doctor's office or community clinic or through the booking or scheduling.
Yeah, generally if it's an appointment that's more than 7 days away, it'll happen through the ordering physician's office. If it's a complex study like interventional radiography or something, we need to know a lot of information, MRI, then the booking clerk will call the patient and get a lot of that information.
And I think sometimes from patients' view, when you're waiting, you don't know what the wait time might be. Do you have a sense of, depending on the modality, how long people have to wait before they can get an appointment?
Well, it does depend. We do try to do a lot of work in Fraser Health to smooth so that, if you're a patient in Chilliwack or you're a patient in Burnaby, you're not waiting exceptionally longer than the other site, that it's similar. CT, there's a lot of demand for CT right now, so those wait lists can exceed, 2 or 3 months right now. Yeah. MRI is much better than it has been historically. Ultrasound much better than it has been historically. So we do a lot of work on that, but I understand that it can be frustrating for patients. If there's ever a change in a patient's condition that the physician is concerned about, they, of course, are always welcome, the physician, to contact the radiologist and say, look, something's changed. Can we expedite this and get it done sooner? Some of the things we struggle with is duplicate requisitions. That really bogs us down, or significant amounts of no-shows. Like, we get things happen, but if you're not coming to your appointment, if you could call us and let us know, even a couple hours before, that gives us time to get an inpatient on the table, and that space isn't wasted, right? So those types of things also contribute to our wait times, but we do our best, and we are working as a health authority to try to make that information more visible and available to physicians.
And I think from what I saw, there's quite a large number of MRIs and CTs that we do regionally. So 318,000 CTs and then 90,000 MRIs on an annual basis. And I think that's been growing quite regularly. So we did more than, I think, 4,000 MRIs from the year before and 9,000 more CTs. And that's been increasing steadily. So you mentioned some of the work that you're doing to increase that accessibility. What are the key areas that you think are going to get us to even better access?
Well, it helped. So post-COVID, we ramped up and we added more positions, which helped more access and appointment times. We opened a new MRI at Langley, another one at Ridge Meadows, which significantly improved MRI wait times. But the demand for the services is kind of outpacing our ability to keep up. So we're doing our best, and we're constantly looking at schedules, trying to move things so that we're taking care of the patients as best we can.
One of the things that I hear a lot from patients and families is around last minute cancellations and ability for people to be called in. And for some reason, it always happens at 3 a.m. I don't know how many stories I've gotten personally where people have come and said, I was able to get that CT at 3 a.m. and that was great because I didn't have to wait as long as I had initially thought.
That was very common with MRI, especially when we were ramping up and we run 24/7. But as we're getting better at bringing that wait list down, people are getting less inclined to want to get up in the night and come for their appointment because they're like, well, if I wait just a little bit longer, I can come in the day or in the evening. Whereas before, it was a lot longer they had to wait, right? So some sites still run, like Abbotsford MRI runs 24/7.
Once you're scheduled in, what happens in terms of preparation for the appointment?
So it depends, again, what you're having done. So if you're having an MRI, let's say, we have to do a lot of work on pre-screening you and questionnaire. We ask a lot of questions, and some people might say, well, that's an awful lot of detailed questions, but we have to know, have you had surgery in the past? Do you have any implants? We need to know. Maybe you were a welder or you are a welder. If you are, there's a high probability you could have metal piece in your eye. So we need to know that information. We will take x-rays.
And why do you need to know that information
because
for MRIs?
The MRI is a magnet. And like the magnet on your fridge, there's no on and off switch. It's on all the time. So if you had metal in your eye and you went into that suite, it would pull out of your eye and would cause damage, right? So we do orbit x-rays ahead of time, get them checked, make sure there's no metal there. If maybe you had a stent inserted in some point in your life, the team will research and look at your surgical reports. What kind of stent is it? Is it MRI safe? If they're not sure, they're going to, contact your doctor. They're going to do all that work. So I know sometimes, especially on the ward, sometimes they'll get frustrated with the team, like, well, I want this right now. And it's like, well, we have to check, right? We have to know for sure that it's safe for you to go in there. So for MRI, there's a lot of safety pieces before you go in there. And then, of course, an MRI, I don't know if you've had one before, it's quite claustrophobic.
Yes. I haven't.
It's very
myself.
tight.
Yeah.
Very tight in there. So, the staff are really good at talking to patients and understanding, you can put headphones on, listen to music, or you can, push this button if you need me and talk to me, in different tips they have for patients. Because you're on that table for half an hour to 45 minutes. It can be daunting. Now, if you're having a CT, we do ask questions around allergy status and things if you're having contrast, but very different than MRI because you're on that table very quick. You're on and you're off very quick. We can scan head to below the pelvis in seconds.
Yeah.
Right.
So the most extensive kind of questions, or much more extensive questionnaire for MRI than CT.
Yeah, exactly. Because there's safety risk and things. And then, ultrasound, for some of the tests, you might have to have a full bladder. And that's because ultrasound uses sound waves. So they need that bladder full so they can, see through it and to the other side per se. Right.
Yeah.
So,
and not much prep required for x-rays, for instance.
Not really. No, unless you're having we consider like fluoroscopy and things like that part of the X-ray family. So maybe you're older, you had a stroke, and you have to have a modified barium swallow, and you're drinking something. But no, there's generally very little prep on the X-ray side in comparison to the others.
So from the community now, you've gotten that prep, and now you're going in for your appointment at one of the hospitals. And what would you expect for that patient or the family member for the day of, let's say, a CT scan or an MRI scan?
The teams will ask you to come early, and that's because, by the time you find parking, get to the department, do your registration, they want to make sure you're ready to go at the assigned time because they can't afford to lose a spot, right? The technologist will explain what's going to happen for you, go through the procedure, and then you're free to go after that. Yeah.
And for MRIs, like you mentioned, sometimes there's, there's lots of, sometimes it takes a bit longer. So sometimes there's music. Some of them have some background, and I remember seeing some calming graphics for some people as well. So there's those types of, I think, things to ensure that people are comfortable as possible.
Yeah, we really try, especially in the last few years. We take that into consideration when we're planning new rooms, or we have donors like Abbotsford was fortunate to have an artist donate their time and energy, and we have what we call a submarine room. It was geared for children, but really the adults love it because it's all done up like the yellow submarine.
Yeah.
So we do try to do things like that, colors, dim lights, or whatever, to help people feel more comfortable.
And what about, kids and, parents must feel pretty anxious if they need something like MRI that takes longer. What do we do for pediatric patients?
We don't do very, very young kids for as far as MRI. They will go to children's just because they have to stay still for so long. But, we have stickers in the department and toys and, explain what's going to happen. Generally, most of the time, the kids are great. It's the parents that are anxious and nervous, right?
Yeah, that's
of course.
Right. Yeah.
Depending what they're there for.
Understandably.
And we do have some, I don't know, call it a contraption. We do put little kids into mobilizing devices to help them hold still because, of course, we are emitting radiation. We don't want to do something more than once. We want to get the picture right the first time. It doesn't hurt the child. It holds them still. But it is hard on parents to see that because,
And what's the timeline like? So if you get your test done today for CT or MRI, how long does it take for, a radiologist to read that, and what happens if there's a finding?
So if the radiologist reports are generally out within 48 to 72 hours to the ordering physician. And then 7 days after the report is released, it's available on Health Gateway BC, so patients can access their own reports. But there is that 7-day delay in the event that there is a significant finding or something that's concerning, and then that physician has time to contact that patient and explain it to them before they just read it.
Yeah, so there's a conversation and understanding of the diagnosis before the patient sees it online.
Yeah. And generally speaking, the reports go straight to the ordering physician. The radiologist, if it's a significant finding that's going to impact mortality or, it's very concerning, immediate attention, they will reach out to the ordering physician and let them know. If you're coming from emergency, the emergency physicians will look at the images as well as the radiologists, and they will enter. We have an online system, of course, and they'll enter what they think it is. And so if the emergency doc will look for that from the radiologist, or if the radiologist hasn't looked at it, the radiologist will look and see what the emergency doctor said, and then if there's any question or concern that something should be different, then they'll collaborate on that. So if it's an imaging test, the report is generated and then the physicians can see it readily online.
Yeah. Sometimes we hear from patients and families a bit frustrating because even when you're in the hospital, it can take a bit of time to get those tests done. And what would be leading to some of those delays?
So I think that's in part that the demand is outpacing the resources we have, or we could be struggling with staffing. Not unlike other healthcare professions, we do struggle with staffing sometimes. We don't have the team, enough people on to get the volume through.
What does the whole comprehensive team look like to run a medical imaging service?
So to run a medical imaging service, you have your radiologist, of course, you have your technologist, we have nursing teams, we have our clerical teams and our support aides.
So it sounds like that, there's lots of people that are involved and engaged in making sure that CT scan is done or MRI is done or X-ray is done. What are some of the kind of novel technologies that you're seeing in this area?
Lots of great things coming out technology-wise. The new CT scanner and Mission, for example, will have additional cameras and helping with positioning to help the technologists with their workload. AI supporting in some of the diagnosis or pre-screening, like mammography has programs where it'll do a first blush. The radiologist can, if they want to, turn that on to just check, and it's kind of like a double read sort of. So there's lots of technology like that, and it constantly changing it and moving forward, and the speed of which we can do some exams almost detrimental because it's almost too fast for the teams to keep up.
Oh, really?
Like when CT started back when I started, let's just say, it was 20 minutes, 30 minutes a scan.
Yeah.
So, you put your patient, you explain to the patient, you put them on the table, you scan them, you had a conversation, got them off, how are you doing, blah, blah, blah. Now, we scan in under a minute.
That's quite a change from, 20 minutes to 1 minute, but I guess it would be quite hectic sometimes because there's lots of people going through that unit.
Yeah. I mean, they do get their pause if they, do a biopsy or something that takes a bit longer, but generally speaking, it's one after the other, which can be exhausting, right?
And you mentioned interventional radiology a few times. Maybe you can explain how that's different than traditional.
So interventional radiology is like an OR suite in the medical imaging department. So over time, and this is another place where we're seeing advances in technology. Yeah, cases that used to be done in the operating room where you had to be opened up are now being done in the interventional radiology suites. So before, you needed an angioplasty, you were opened up. And then over time, isn't this great? We can go through your groin and feed a catheter. Well, now we're going through your wrist. Like it's, all kinds of things we're doing for that. Also,
so it's minimizing kind of surgical intervention through like minimally invasive type of.
Yeah, so your recovery is super fast. Your stay in the hospital is shorter. We also, of course, we take care of a lot of cancer patients, whether they're like, port insertions or drainages, So yeah, there in that area, it's one-on-one. Like it's usually two technologists, two nurses, and a radiologist in the room. So it's very cohesive, close team working together to take care of the patient.
And I imagine in that area, there's lots of advancements that are happening quite quickly, right? I'm sure you've seen in your 38 years of career some amazing advances, but also have had some really touching patient experiences. Is there one that's been really memorable for you?
I did spend some time in mammography, and when you're finding those cancers and taking care of those patients, it is very rewarding.
Can you share a little bit more about your experience with the cancer patients?
I think, if you're looking like mammography specifically with breast cancer, when you get to meet these ladies and you realize that, the mammography you provided and the follow-up you provided meant so much and got them on a journey that, yes, was stressful for them, but might have saved their life, probably saved their life. It's so rewarding. I did, I know they're not existing anymore, I don't think, but the Fraser Valley breast cancer ladies, I would speak and do presentations with them, teach them, take phantoms, teach them how to do breast self-exams, different things like that. And you just hope that if one or two women even made a change in what they were thinking, or offer suggestions like, I know going for your mammogram isn't fun, right?
No,
Nobody
not at
likes
all.
it. But,
And
why
it's one
not?
of those things people are like, oh, I guess I have to do it. But it's like,
Exactly, right?
oh, when is that date can that date be a little bit moved or
Exactly.
whatnot?
Well,
Nobody
especially
looks
the
up-
first
looks
one,
forward to it.
right?
Yeah.
But you know what? Why not go with a girlfriend?
Mm-hmm.
Go with your sister. Go with your mom. Take a bunch of you. Make a bunch of appointments in a row and then go out for lunch after.
Mm-hmm.
Because you're not going to cancel if
Yeah.
you're booked with your girlfriend
Yeah.
or your mom.
Yeah.
But if it was yourself, you just had one appointment, you got busy, you might say, you know what, I'm just going to call and like, push it out or whatever. So we've seen that before. Like,
Yeah.
why not?
There are ways to make a memorable experience that's more positive, that you've really great suggestions actually to make something that you're not looking forward to into something that you're looking forward to.
Yeah, and try not to be afraid of it. It's there to help you. And if we do find something, and quite often, to be honest, especially on your first mammography, we do find something because we don't have the previous images to compare to. And as much as we say, like, chances are it's nothing, chances are it's nothing, but I know I've been through it too. It's like, what do you mean you found something, right? So you just go through that process and make sure you're good. So I just feeling like you've helped somebody just feels great.
Yeah. I think that's I think often why people like yourself have entered the caring profession that you're in and then continue to do so. So thank you for what you do. And the last question I ask everyone is, what's if you were to describe future of healthcare in one word, what would it be?
Exciting is popping into my mind. Yeah, just because we have seen technology and the changes, but it's going to start ramping up, I think, and it's going to be moving forward in a really fast pace, I think.
Well, thank you so much for joining the Heart of It today, Bernice. Pleasure to have you.
Thank you for having me.
Join us next time as we continue to get to the heart of healthcare. Don't forget to rate and subscribe to this podcast. The Heart of It is produced by Fraser Health Communications and Public Affairs.